Okay, let's revise a little bit and then I will talk about the assignment number 3. So, how can you assess the quality of a QSR model? What can you estimate? If there are different models, how are you going to compare? Okay, R square, you can estimate. R square is one of the things. There are so many other things, but we are not going to go into that. Just consider that R square is one of the important thing. So R square, how can you calculate? Last time I explained something in terms of graphs, like how can you estimate R square? So on which two terms you should know so that using the Excel sheet you can estimate the value of R square.
TSS and RSS, sir.
TSS and RSS. Okay, so this formula, it was mentioned here that R square is equal to 1 minus RSS by TSS, and I explained to you RSS means residual sum of squares, where you are trying to see the difference of each and every of your data point with your calculated model value, whereas total sum of square was something which is the difference of each and every data point with the average of all the data points. And we say R square is one of the thing where we saw the improvement you are interested to understand when you are moving from an average value to a if you are fitting it a linear curve, so how much is the improvement when instead of fitting a average value you are fitting a linear line, a linear straight line. Okay, so that improvement we called as explained sum of square, and I said this R square is actually proportional to the improvement explained sum of square, which is nothing but the improvement we can calculate in terms of TSS minus RSS, and ESS can be you can get by the difference of these two things. So I said this R square is proportional to ESS, and ESS means TSS minus RSS, but to have the value in terms of 0 to 1, you are going to have some normalization factor. So you are normalizing it by TSS. So you are getting finally this particular formula. Okay. So I said if you want to compare different models, if there are number of descriptors are varying, so then you cannot simply use the R square value for comparison, as we have seen that with increasing the number of descriptors, there is some bias that gets created within R square value. So to correct that, we had seen something called as adjusted R square value. So this you should consider whenever there are a different number of molecular descriptors are coming into picture and you want to compare the different models with each other. So based on this, whatever you have learned, like now, I think all of you, if you have any data set X of I, Y of I, you can come up with the model depending on how many descriptors you are having, and then you can also compare each of them with each other. So just let me share the next assignment. Okay, so assignment number 2, you have to, some of you haven't still submitted. I have given the deadline till Tuesday, so you can do that. So there, like we are going step by step. In assignment number 1, you are just like try to represent the structure on the computer, and you created the molecular files and you visualize them. In the assignment number 2, using those structures, you can now estimate the different molecular descriptor value. And in assignment number 3, you are going to develop different models, and you are using your model, you will try to identify the best possible compound. So this is actually, in this assignment you are doing the work of drug design based on some initial data, experimental data. So that experimental data, again you are going to use the same paper of 6-sulfur drug. So you already have some value, experimental value in that, and the molecular descriptors also, I said experimentally you can determine, or you can determine using the software. So in your case, now you have in this assignment number 2, you have already determined the molecular descriptor values using the software, so that you have to use in this assignment. and the values which are you have to use for activities. So let me just explain the stuff related to activity value, what you have to do. Okay, so again in this paper you have these 6 sulfur drugs, and for 6 sulfur drugs already there are some molecular descriptors are given in this paper, but I said you have already developed your own molecular descriptors, and I also said like verify whether at least this Wiener index is matching, and you can also go at level of matching the molecular weight. There were some bugs into the software because of which I asked you to use only the particular molecular file which gives the correct values. Okay. So here now consider, now what about the activity value? I said you need X and you need Y, and based on that you have to develop models. So you know about the X values, different X or X2, but what about the Y values? So Y values you can see here, these are nothing but always your activity value, and these activity value are determined for your sulfur drug against these 3 different bacteria, E. coli, K. pneumonia and B. subtilis. And you can see for there are for different compound like E. coli you can see. So I said compound number 1, 2, 3 is missing, 4, 5, 6. This one 1, 2 is there, 3, 4 is missing and 6 is missing. So you can see like this particular compound only are active against this particular bacteria, K. pneumoniae, and similarly here. So now you can see here there is something. What is this activity value? They have said something about the zone of inhibition. Okay, and some values are given in terms of concentration in microgram per milliliter, and this different concentration they have used for the different compound 1, 2, 3, 4, 5, 6, and this different concentration 10, 20 microgram per milliliter like this they have used, and then they have calculated these activity values like here you can see 9.7 or something for different concentration. So you can see what is exactly happening for this different concentration. You are getting different value of biological activity or antibacterial activity. But if you want to tell me what is the unit of this activity here, what is the unit of the activity value? That
Millimeter.
yes, the activity value it is measured in terms of some zone of inhibition, and the values are in millimeter. So you might guess how can these kind of activity values in terms of some in the unit of length or something, how it can be in the format of millimeter. Again, who answered that question? Millimeter?
Me, sir. Prabhat.
Prabhuda? Yeah. So, like, can anyone tell me what do you think how these activity values can be measured so that you can have this in terms of these millimeter values?
So they have a petri dish
Uh,
where they first have the bacteria uniformly distributed, and then they put the required compound in the center,
okay.
and then they measure the diameter of the zone in which the bacteria is dead. So that gives the zone of inhibition.
Okay, good. So I guess like that day the Hamulisa's presentations, is it from there?
Yes, sir.
Okay. So I guess you and Nikita were there.
Yes, sir.
So yeah, something is there like you are having some solution in the petri dish where you are going to have some antibacterial thing. I have an image for that I will share with you. Just a minute. Just a minute. Okay, so I hope you can see this image. So always you can consider that there is a petri dish, and in petri dish all this antibacterial kind of solution will be there, and then you are going to keep your drug molecules into that petri dish. Okay, so this is like some kind of base. Even I have never done this experiment, I have just read about this. So you can consider some cellulosic material is there which is having that drug compound. Okay, and this has been adsorbed into this material, and this as a, like a pellet or disc you can say, or some kind of tablet you can consider that you have put it into the one part of that which contains the antibacterial solution. And then what will happen? This drug compound, it is going to, as it is, we are calling it as some antibacterial solution. So you can see some kind of changes in the color surrounding to this. Okay. So based on how you see the changes, like here it has been shown by, okay, it is like you can simply see this bottom surface like the black color. So maybe that compound has been reacted with the particular solution, and this is the area where the activity, like it is inhibiting the growth of that particular bacteria, so that part is getting disappearing. Okay, so this you can say like it is getting disappearing. So sometimes you can have this kind of complete inhibition, sometimes you can have just minor inhibition, or simply you can say again it will grow back and you can see some kind of regrowth is there. So this is how actually people understand this, how much that compound is particularly effective. If after a particular time, whatever that experiment has to be done, if you see that this is stable and the compound is not growing, regrowing, so you can consider this is something in terms of some, this is circle has formed. So you can measure the diameter of that circle, and that diameter you can consider in terms of some length unit, like that there they have been given in terms of millimeter unit. So you can consider more the inhibition, like more the diameter will be. So that much you can say your compound is, if it is less diameter, then it is less effective. There are some criteria for that. The biological people knows more about. But if it crosses a particular, it has to be active. It has to cross a particular this border line, and once it crosses, then only they will consider that it is like really effective against that particular bacteria, and that you have to measure it out. So in this paper, what I had shown to you, you can see all these values are nothing but these millimeter values. So for different concentration, they have done this, and simply here they have shown the average value. So this particular average value, you should, even though the units are in length, you should consider this as some values of activity of this particular compound against this particular bacteria. Okay, so for all the three drugs, or for all the three bacterial thing, for each and every drug, you can see. Now you have the values of X from your earlier assignment number 2, and you have, like in this paper they have given different topological indices only, but in our case we have chosen different molecular descriptors like log p values, molecular weight, and again the binary index, and one more was there. I forgot, maybe van der Waals radius or something, what van der Waals volume. So now you have to relate these antibacterial activity with that with these descriptors, and you want to see the dependence of this activity onto this descriptor value. So now you can come up with different models. So you know, like for developing the model, as you have the values of y and x, you have to determine the values of the coefficients. Like in this case, you can see antibacterial activity against E. coli. Just they have chosen the descriptor as Wiener index, and based on that, they have estimated some values of coefficient. So this you can consider as some value, final value of activity y is equal to some a0 plus a1 x 1, here they have used the multiple linear model, so plus a2 x2, that's how they have measured. And you can see for each of the every model, like they have developed different model for all the different bacteria, and they have even tabulated all the data, like if this is the model number 1, what descriptor they are using, if they are using one descriptor, if they are using multiple descriptor, so how the different coefficients are coming into picture. So again, like in this table, different coefficients are, you can see. So here you can see the r square a value, which is nothing but the adjusted r square value that they have determined, that it shows the good amount of correlation between the Wiener index and the antibacterial activity. So based on this, they have done some other calculations. So now only this much information we need from this paper, so that you can do your own assignment. So if you see your own assignment, I hope you can see the word file. So see what you have to do. You now have the value of activity and descriptors. So for only E. coli bacteria, out of those three, only for E. coli bacteria, you are going to develop different models. So you have to take the antibacterial activity value, and you want to relate in the first question, you develop a simple linear model by relating the antibacterial activity with the simply binary index. Okay. In the second question, you want to develop a multiple linear regression model by choosing two descriptors, binary index and X log P value. And similarly, in the third question, binary index molar refractivity value. For again, instead of two, I have given, yeah, here also I have given 2 X log P MR. So you will see different combination for all the different descriptors. And like I have given the first one to be simple, the third one should be little bit complex. So I have added 3 molecular descriptors here. Okay. So for each and every model, what you have to do, you come up with the values in the Excel sheet, like I had shown you earlier, Xi and Yi, and you already have my PPT, so you already have some equations for you. So based on that, you can calculate the values of constants, and using the constant you can complete your model. So these constant values you will get for this simple linear model and multiple linear regression model, where there are just two coefficients, because I have derived only for this. But for uh, three descriptor values, you have to develop your own model. And I said you can do this calculation by some trend line and by using some extra things like add-ons or something, but you have to uh, calculate those whatever are needed to complete the model, all those factors. Like if you need the product of xi yi or xi square yi, I would say do all those calculation in the Excel sheet. If you are directly providing the values, final values of r square by something outside software, so there should be some penalty. For your confirmation, you can use that. You can try to find out some extra software which can directly calculate something. I don't have any objection, but at least for these things you need to do some calculation in the Excel sheet so that you understand this in depth. Okay, so I said here in the end, I have mentioned for the submission part, like no need to submit the derivations in the assignment. What a derivation or something, I'm not asking you to submit, but if you need, especially for the fifth question, you are going to need the derivation. So looking at the earlier developed equations, you can actually come up with the equation so that you can estimate the constants even in your fifth part. Okay. So if you don't have this equation, I said you should develop them first. Then if you develop all these five models, QSR models, so you have to compare all of these models. So for comparison, I could have directly asked you the question like compare the model without even telling you that you need to evaluate the adjusted R square values. But I have specifically mentioned that there should not be any confusion, but in the exam or something, you should know that without calculating the adjusted R square values, you cannot compare. If you simply calculate R square value or something, that is not sufficient. So here you have to estimate first R square and then adjusted R square for all the five models, whichever will be having the highest value of adjusted R square close to 1, that you should prefer as your base model. Now the last question is very important. In this question, actually you are doing your real drug designing. Okay, so see the question, using the base model. Okay, out of the early, whatever is your base model, you should calculate the antibacterial activity of a new compound. Okay, now you have to do it for just a one compound, but if you imagine that if you have some sophisticated software which can do all these things properly, I said even the concepts of artificial intelligence and artificial neural networks can be also used in this kind of studies. So you can, using those studies, directly find out which molecular descriptor, like here just we are trying for 3 descriptors, but a range of descriptors those techniques can utilize, and they will find out the adjusted R square values for you, and based on that they will come up with the like the base model. And using those base model, now there can be then millions of compounds again, but here I am giving you a simple task. Just take any compound. Okay, now that compound you are choosing little bit randomly, but if you have to utilize some sophisticated software, so it will screen out all the compounds in the database. So here, whatever compound you are choosing, what you have to do now, compound I am saying there should be some basis for this structure what you have already have. There are concepts like similarity search, which is also like one of the technique where people try to identify like similar compounds are having similar properties. So if they already know that this particular structure is good against this particular bacteria, so what they will do, instead of then choosing a very new compound, they are going to play with some functional group. So this functional group you can consider to be R, and this R functional group people will modify, and they will see whether the activity value is, if it is coming good or bad. So what you have to do individually, this R group, it can be any functional group. It should properly satisfy the criteria of all the valences or something, but it should contain minimum 5 to maximum of 25 atoms. I'm putting minimum 5 because then otherwise you'll simply add some one single atom or something, and all your molecular structures for different students will be similar. So I don't want that. I want each of you to choose a different structure. That's why I'm doing this. And maximum, do not choose like even a very high functional group, so that again it will become very complex. So both of these you have to maintain. In reality, if you have to do this problem, what you will do, if you know the techniques like similarity search, you will put this molecule into that software which can do some similarity search study, and it will give you the compounds which it can rank based on the something called as similarity index. And whatever are the best possible top compounds, you can choose actually one of them. But here we are doing this randomly. So if you do that, you have to find out whether the antibacterial property of this is good or not. Now, how will you determine whether the antibacterial property of this compound is good or not?
Based on the model and its molecular descriptors, we can predict the activity
Directly by the looking at molecular descriptors.
and the model that we developed earlier.
Okay, so something you have to, yeah, from the activity values. Okay, so activity value you already know from the paper. If you again go back and see this paper, so you can see now for these 6 compounds, the 5 compounds have been shown that they are at least active against them. So you can see the activity value. Now we can consider the higher the value of activity means it is a good compound. So if you are having the values ranging from 17.34 to 22.78, which is the lowest and maximum value, we can consider if something is coming the value between this value 17.34 or 22.78. So that compound is, it's like one of the good compound. Okay, but if the value is lower than what you are getting 17.34, we are going to keep the criteria that that is not a good compound because antibacterial activity is less. Similarly, if you are having more value than 22.78, then you should actually consider that whatever compound you have actually considered for your study, so that compound, if it is having a value more than 22.78, so it is one of the best possible compound you have got using your model. Now your job is done here. You can consider like using your chemical informatics study, you have told to the experimental people that this is the one of the best possible compounds I have. Then later on, now as your models will be having some assumptions, later on they will be studying only that particular compound. They are not going to go and study all these different compounds, and they might find out that okay, whatever you have found out through your study, yes, it is showing some good values or not. If it is not showing, maybe whatever assumptions you had initially or whatever molecular descriptors you have chosen, so that those are not sufficient, so you have to again come up with different molecular descriptors, or whatever the initial data you had, experimental data measurement you had done for some 5 those 6 compound, so maybe those that you haven't done accurately, so that's why also your model is incorrect, so maybe that's why you are not getting the correct value. But now here we will trust whatever values you are having from the experiments, the activity values we will trust, and the descriptors also whatever I have given to you, you can consider that even though the artificial intelligence studies might be telling you that these are the good descriptors, but here we are assuming that these are the good molecular descriptors. So this is what you have to do. You have to find out your own compound whether it is good. Even if it is bad, there are no mass reduction or something. But I think you should aim that like technically how will you approach whether the particular compound can be having good antibacterial activity or not. You try to do some literature review. You try to go through some research papers like which functional groups can give you good antibacterial activity. So instead of doing just adding some very small groups to this anything, you can like if you know like some phosphorus groups or something can be having a good antibacterial activity, so play with the phosphor based group and then do this calculation. Maybe then chances that this is like not where you're doing very randomly, then you are like having some scientific basis by which you are saying that okay, I can get some good value. Okay. So again, like when you submit this, you have to have an Excel sheet, all the values you have to put here. And I said use multiple tabs if you need in this single Excel sheet. Do not send me multiple sheets. Use different colors to highlight the values of constant and adjusted R square values. For checking, it will be easier for me. And yeah, these things you put and submit. I have given a very like you have like there are more than like around 2 weeks. This is just before your exam, 3 days before your exam. So if you want to finish it early, please do it. Do not wait for the last month. Okay. Any questions are here? Okay, I will jump to the next one. Okay. Just a minute. So I said, like you can consider with this QSR study, we will just stop here. Like you can consider with the assignment we are finishing. I said the same thing what you have done for drug design, the same thing can be applicable for material design. So again, some property like in the earlier introductory slides, I have shown some slides related to QSAR. If you go back and read about the material design, some dispersibility of carbon nanotubes or something I have given in the slide. Like if you want to design some new material and you are looking for some property, like if you are looking for even some less toxic compound, so these kind of things also it can be dependent on some molecular descriptors and any of this property. If you can design different molecules onto the computer where little bit differences are there, so using the computers you can estimate the descriptor values for them, and experimentally for few compounds you can estimate whatever property you are looking for, and you for the different compounds you can draw the different structures and you can come up with the descriptor value again and you can put it into the model. So you can get the property value and you can say whether that property, suppose if you are looking for anything like a more hydrophobic structure, less hydrophobic structure, so those kind of thing property you can get, or something like for water purification some property you are interested that you can estimate. So this QSR model, like regression based model, you can consider. I started and I said when there are virtual screening methods, and this virtual screening method in drug design or material design, like in especially for your drug design study, we divided into two parts: ligand based drug design and structure based drug design. So there are other models, like some of this stuff we will see in short later on. But you can consider, you know, that what is ligand based drug design when there is no information related to the structure available, simply based on the idea of some active compound. Experimentally you come up with the ligand based drug design. So if you see how this flow is going, earlier I had shown you a straight drug discovery flow chart. You can consider this something like a funnel based drug discovery process where as you go from top to bottom, you can see there are cost will be increasing. Why the cost will be increasing? Earlier you are going to use only the simpler method, and then more and more sophisticated methods you are going to use. So these are going to be more complex in terms of both experimental studies and even the in silico studies. So in silico studies, generally at the lower stage, you only do the experimental clinical trials. But if you see these top ones, in the top ones, we have started with this kind of study. Like you can consider the ligand based studies what you have done, it is somewhat a crude method. Okay, it is not a very sophisticated method. The sophisticated method, some of them we will start learning now, and there can be even more sophisticated method which we might not even understand in this course. But just understand what initially we have done. Like we have learned something called as this ADMET. Okay, ADME means what? Like some of the features like molecular weight or X log P. Simply you can estimate and you can have a simple criteria that the molecular weight less than 500 I do not want. So you have initially itself you screened out so many compounds because there was a problem with chemistry space. You had so many millions of compounds, more than that. You had more than millions compounds. I wanted to do a simple screening because the later on sophisticated method you cannot use for each and everything. Otherwise, this will take years. So you shortened it out. Then methods. So initially, the simple screening was done. There was some rules like Lipinski's rule of five. Okay, so these kind of methods, simple screening people have used. Then you are jumping to methods like QSAR, which are more sophisticated than the earlier simple screening, but they're still not that great. Means they're crude level, but this also can be used for a big amount of screening. So you are coming from the level of a lot many compound to some heat molecules. Okay, then from heats now you have to jump to lead compounds. Okay, so even more sophisticated methods should come into picture. Now, if you see what was crude about this method when you are talking about the ligand-based method and what is the about the structure-based method, what was the crudeness in the ligand-based method that we'll try to understand. Okay. So now the new method, what we are going to use, that will be structure-based drug design method, where some kind of docking is done and we do some kind of scoring. And this can be utilized for identification of some thermodynamic parameters. So what is this molecular docking method? Anybody has any idea what do you mean by molecular docking? Okay, they have mentioned here, this is one of the powerful approach for the structure-based drug design. Like I had some ready-made slides available, which were good. So I have taken from that and some information I have taken from this research paper. Okay, so if you want to go into detail, you can see here. Now, if you see our virtual screen technique, if you want to talk about molecular docking, first you need to understand that we had this ligand-based drug design method. There are other methods also, and similarly we have structure-based drug design method. Now, in this method, what will be the difference compared to the earlier one? Now, the structure of the host molecule or the target molecule, it is already available. In the earlier drug design method, you did not know the structure of your target molecule. You only had the idea about like what kind of molecule might be binding to it because of which it is creating the effect. You did not have the idea about structure. Like here I always give the example of that curcumin molecule what you find in the turmeric. So you know from ages that turmeric kind of molecule are very good against the antiseptic properties or something. Even there was, if you know some, there is one interesting discussion here we can do. Like in India, there is that institute NCL, and NCL there was a former director called his name was Raghunath Mashelkar. They have actually tried the outside the foreign companies. They were trying to even have their own patents onto this, and they were trying to own the copyrights that they have discovered this method, like the curcumin active against the like cancerous property or and this antibacterial property. But this institute, they have actually claimed that in India, these kind of things are known from the ages. We already know that so this cannot be given the rights to any particular company or something. To have that scientifically only they have discovered that the turmeric is good against the antibacterial property. So you can consider based on this, you already had knowledge that even though you did not know any structure where they are going to act or something, but you had the idea. Now in the next method, we are going to do, I said this was a crude method. And in the crude method also, people are trying to make it sophisticated, like only from the knowledge of the particular ligands which are active, what you are going to find out through your calculation. People are trying to come up with a pseudo receptor structure. Pseudo receptor means this will be the pseudo cavity pocket, and then this pseudo receptor, uh, they will try to uh, dock, they will try to see the activity against different compounds by trying to dock it with the actual receptor cavity. Now here you can consider, you earlier did not know how the structure look like, but based on what base compound you have found out, you have came up with an imaginary structure for the receptor, and now the structure of the receptor will be used for actual structure based drug design. Okay, so these kind of things are there that pharmaceutical companies are developing. But now we will see where we already know the proper structure of the molecule. Like for HIV protease molecule, I said this is responsible. Definitely people know that for AIDS disease, that is responsible. So whenever you are going to come up with the best possible compounds for that disease, so you have to focus on HIV protease enzyme or that molecular structure. So this kind of structure, if you see, there are some experimental techniques. People know their three-dimensional structure. Again, I said they are nothing but each and every of them are nothing but the protein structure, and protein structure are simply nothing but the sequence of amino acid chains. And this amino acid chains, when in your body, they adopt a three-dimensional structure. So this is called as three-dimensional native structure, final structure. And this final structure has some cavities, and I say most of the time they are hydrophobic in nature, to which the extra compound can bind, because of which it can be in its active state or inactive state. And that active state or inactive state will define whether that compound will be able to carry out its function or it will not carry out. For example, this HIV protease, if something else binds to it, the pharmaceutical compound, and there is a good activity, so then it will no longer remain infectious. So that's what you want to develop the compound. So if you go into this detail of structure based drug design, now you know how the structure is. So now you can do some realistic studies. Now realistic studies means earlier you were doing the blind studies, you didn't know how the ligand is going and what it is exactly doing into the body. But now you can actually see when the particular ligand is going and binding to a particular receptor, so how it is going to interact with this thing. Now this word is very important for our later studies, interaction. Why it is important? I said in QSAR, did you have this word ever? Interaction, did you use the word? You did not use the word. Simply I said you had some structure. The structure, it was like a dead body for you. It did not know how to interact with some other compounds. Based on just the structural parameters, the software is able to calculate some values. But maybe all of those values are not sufficient to give the realistic picture. To, to give the realistic picture, you should know how that particular pharmaceutical compound is actually interacting with the different parts of this particular receptor, and then only you can consider what kind of changes might happen within the receptor, because of which it can become active or inactive. So all this concept, like how the interactions are happening, and how the what is exactly docking. In short, I can say docking means something nothing but you are going to dock something within a particular scene. Like there are some docking yards, docking stations. So something is being docked into certain. So here you are basically docking the compound. I can show you this image. Like you are going to dock some compound, pharmaceutical compounds, into this receptor cavity, and that is nothing but you are doing molecular docking. And based on this you can come up with the some parameters that you have to again use as the basis for the ranking. What was the basis of ranking for you in the QSR study? Can anybody answer me? What was the basis for ranking for you in the QSR study? Okay, next time I will ask you this in
Activity.
detail. Activity, yes, good. So that is what here also we should have some criteria, you can say, for screening, and that we'll try to understand it later. If there are any questions, please ask. Otherwise, you can.